Hello and welcome dear learners to the NPTEL course on Healthcare Quality Management, Infection Control and Patient Safety. In the Module 3, Patient Safety Management, Infection Control and Medication Safety, in the Chapter 35, we will be discussing on the medication safety. The contents will be adverse drug reactions, severity assessment of the adverse drug reactions, and casualty assessment of the adverse drug reactions. So what are adverse drug reactions and what really adverse drug reactions need to be taken very seriously about? All the drugs can produce adverse effects. Adverse events happens by the adverse effect which may develop immediately or only after prolonged drug use. So you need to understand the importance of the ADRs and how the ADRs need to be reported. ADRs are more common with multiple drug therapy and usually they are being seen in elderly patients, aged patients or terminal ill patients. The chances of ADR increase when a drug is given for a long time or in patient with allergic diseases. ADRs are the fourth to the sixth leading cause of mortality in USA, which are responsible for more than 10% of the hospital admission. Limited information on ADR is available in India, and so where it is very important actually to understand that when there is no reporting or sometimes there is no information, it is very important that there might be a big iceberg actually for that. 30 to 50% of the ADRs are preventable, incidence of 10 to 25% documented in the clinical settings. So you can understand with this numbers which are being spelled over here are like a very limited information that we have got, and with that we can present that what the issue might be more grave with. Patient may need to tolerate mild ADRs to obtain a therapeutic response, which is many times advised actually that when they encounter also the ADRs are being ignored. Some of the ADRs are dose related and disappear on the dose reduction. Some subside with continuous use, example drowsiness with paroxetine. And many such of the drugs which are causing the ADRs are most of the time ignored because they go with the doses reduction. A few of the ADRs are hazardous. Sometimes they are unacceptable and sometimes it requires that the patient or the prescriber require to discontinue such drugs. How an ADR reporting is very important, how it is very beneficial to be made understood to the healthcare worker. Importance of the ADR is being highlighted over here, and the medication safety which can be improved if you are reporting the ADRs. Preventing the tragedies. Reporting ADR can prevent tragedies with a new medicine. Withdraw the medicine. Examples like severe medicine have been withdrawn due to ADR reports, that is thalidomide induced leukemia or terfidine induced arrhythmias, temefloxacin induced hemolytic anemias, and robecoxib induced cardiac arrhythmias. Surveillance and reporting. Post-marketing surveillance helps detect less common but severe ADRs. All the healthcare professionals should report ADRs properly. What is the benefit preventing and safety? ADRs cannot be prevented 100%. But if there is a prevention culture to be developed, 35 to 50% can be prevented. Preventing ADR is essential for medication safety. It ensures that if you have to go ahead for medication safety, it is important that if the ADRs are reported or there is a culture of reporting ADR, it can give a major benefit to the medication safety. How to prevent ADR to happen? If at all the adverse drug reactions need to be prevented, avoid inappropriate drug use, including the drug-to-drug interactions. Use the correct dose, correct route, and frequently based on a patient need. where the illicit history of the drug allergy and the condition like asthma and all need to be taken care properly. Adopt a correct drug administration technique. For example, the non-steroidal anti-inflammatory drugs to be given after meals to avoid the major side effects which is likely to happen with these drugs. Ensure appropriate laboratory test monitoring, which is very important to prevent the ADRs to happen. How to deal with the ADRs? Be alert to the minor changes in a patient's clinical status if though the patient is noting it or has been reported. Listen to the minor complaints as they may signal to the future severe reactions, which can be an alert or a sign actually which may trigger that it may go to a severe level. Dose may be reduced or changed after consulting the prescriber. The patient should be told what ADR to expect so they do not stop taking the drug themselves. Advise the patient to report ADRs immediately. If a serious reaction is suspected, withhold the drug and contact the prescriber. So, if you can understand in the entire dialogue, it is more towards the patient and the prescriber. The players who are there in the entire hospital who come across this ADR, they need to report through the patient to the prescriber, which becomes a very important part if you have to see and working or a culture to develop of reporting ADRs to be get benefited with. How to deal with the area? Be alert to a minor changes in a patient's clinical status. Listen to the minor complaint as they may signal future severe reactions. Dose may be reduced or changed after consulting the prescriber. Patient should be told what ADRs to expect so they do not stop taking the drug themselves. Advise patient to report ADRs immediately, and if a severe reaction is suspected, withhold the drug and contact the prescriber. The severity assessment of ADRs. The ADRs can be reported mild, moderate, severe and lethal. For the mild part does not require a treatment. Example, a slight sedation, mild antihistamine response. Or a moderate which requires change of a drug or leads to prolonged hospital stay which may have a major effect on the patient or even the hospital policy. The severe ADRs which comes as hypersensitivity reaction leading to anaphylaxis. The most severe ADRs require immediate treatment. Example, adrenaline. Potentially life-threatening may also need hospitalization and can cause permanent damage. And when you come across lethal ADRs which results in death of the patient. Example can be complete A to V block by digoxin. So this is an representation of the severity and the assessment of the ADRs to be done at a facility level. The causality assessment of the ADRs. The causality assessment of the ADRs is based on the temporal relationship between the drug use and the ADR, which includes challenge, de-challenge, and re-challenge. What is de-challenge? De-challenge is ADR resolves after stopping the drug, which gives a positive. And the re-challenge is the ADR reappears on restarting the drug, that is also positive. So, establish a knowledge about the drug's action, the kinetics of the drugs and the adverse effects. Characteristic clinical and laboratory findings to be added to understand the assessment in more depth. Likelihood of exclusion of the other exploitation like the other drugs, concurrent diseases and chemicals need to be go in a very depth in understanding the issue. Data interpretation, that the analyzed data is categorized to determine whether the drug is truly responsible for the reaction or not. The WHO causality categories like certain, probable, and possible need also to be understood when you are developing a causality assessment of the ADRs. What is the WHO causality categories? A WHO causality categories can be seen in three sections: certain, probable, likely, and possible. A clinical event including laboratory test abnormality occurring in a plausible time relationship to a drug administration is under the certain category, which cannot be explained by the concurrent disease or the other drug chemicals. The response to the withdrawal positive D-challenge is clinically reasonable. Re-challenge is positive that the ADR reappears on the re-administration. So it is very clear on this side that how it is very certain that you can see on prevention part to be taken very seriously. Where it is probable and likely, a clinical event which is including a laboratory test abnormality with a reasonable time sequence to the administration of the drug, and unlikely to be due to the concurrent disease or other chemical drugs, shows a clinically responsible or reasonable response to withdrawal, and a re-challenge information is not necessary. In the third and the possible category, we can see a clinical event including laboratory test abnormality with a reasonable time sequence to the administration of the drug. It could also be explained by concurrent disease or other drugs. De-challenge information is lacking or unclear over here. So, the WHO causality categories have distinguished and make it very clear with respect to certain, probable, and possible of the causes. So, in summary to this chapter on ADRs, we are finding that ADRs are unintended, harmful responses to drugs that may occur immediately or after a prolonged use. It can be majorly seen in high risk in elderly patients and those on multiple medications, which is also a growing problem, and we can find a large proportion of the ADRs, that is 30 to 50%, are preventable. The institution can work on developing a policy towards encountering the ADRs, making a careful prescribing, monitoring, and patient education, which is essential to deal with this issue of ADRs. Prevention strategies include appropriate drug selection, correct dosing, avoiding the interaction, checking the allergy history of the patient, ensuring proper administration and laboratory monitoring, which comes to fulfill the entire preventive strategies that the institution need to develop. On the management part of the ADRs, you need to see the involvement of early detection, which is added by listening to the minor complaints, adjusting or discontinuing the drug if at all if it is possible, and majority of the time advising the patient to report symptoms promptly, which will give us more proper way of managing the ADRs. Adverse drug reaction evaluation uses severity grading. The grading is from mild to moderate, severe, and lethal. All the four gradings and evaluation on that, and causality assessment, which is by the WHO, that is certain, probable, and possible, which help us or the healthcare workers to determine the drug's role and guide in the clinical decisions, which makes us more responsible actually to deal with the issues of ADR over here. So thank you for the patience listening, and here are some few references actually which will help you to develop your understanding more better towards the ADR part. So thank you with this.